Today my topic of presentation is neonatal resuscitation. Resuscitation, it is a Latin word. Resuscitate means to arouse again. More than 5 million newborn die worldwide. Among them, 90% die due to birth asphyxia. And 10%, only 10% neonate need some form of assistance, that means to initiate breathing at birth. And only 1% need advanced resuscitation. In Indian scenario, it is also the birth asphyxia, one of the leading cause of neonatal death. Before going to the core topic, little bit recapitulation about fetal circulation. Placenta, which acts as a fetal lungs, and blood from maternal side to fetus goes to the umbilical cord, and the blood arrives via the umbilical vein into the fetus, and most of the blood goes through the ductus venosus into the heart to the inferior vena cava, and from the inferior vena cava from left atrium goes to the right atrium through the foramen ovale, and from the left atrium to left ventricle, and goes to the heart, body, and back to the placenta via the aorta. And also the blood from the right ventricle, it goes to the pulmonary artery, and through the ductus arteriosus connects the aorta with the pulmonary artery, further sending the blood away from the lungs and into the aorta. So all this is the mixing of the blood, and what happens just after birth? It is sending from the intrauterine circulation to extrauterine circulation, and where the patient newborn initiate breathing, there is expansion of the lung and decrease in the pulmonary vascular resistance. So the blood goes to the lungs through the pulmonary artery. There is no shunting through the ductus arteriosus, and also systemic vascular resistance is increased. Left atrium and left ventricular pressure increase. So foramen ovale also closes. So if there is any interference in the fetal circulation during intrauterine life, or interference from changing from intrauterine to extrauterine life, leading to birth asphyxia. So the main pathophysiology of the birth asphyxia, it is the interruption of the umbilical blood flow, failure of the gas exchange across the placenta, inadequate perfusion of the maternal side of the placenta, obviously a compromised fetus, anemic or growth retarded fetus, and also failure to inflate the lungs and complete the change in ventilation and lung perfusion at birth. This is the main pathophysiology, and there are numerous lists for these reasons. Now the consequence of the birth asphyxia. Initial lung expansion needs higher ventilatory pressure, failure to expand the alveolar spaces resulting hypoxemia and asphyxia. Asphyxia leads to progressive hypoxia, hypercapnia, hypoperfusion, and acidosis. And consequence of hypoxia and acidosis are the pulmonary vasoconstriction. So the pressure in the right heart increases more than the left heart. So opening of the ductus arteriosus, right-left shunt, myocardial dysfunction, poor cardiac output, metabolic acidosis. All this leads to multi-organ failure, and this has the implication in the later in the life of the newborn. Asphyxia leads to apnea, an initial period of rapid breathing, where the heart rate and the blood pressure gradually falls and enters into the phase of primary apnea. Only stimulation and supply of the oxygen can lead to normal respiration at this stage. But if primary apnea allowed to goes to further, then initial phase of irregular gasping respiration and heart rate and blood pressure further decreases and enters into the secondary apnea. In the stage of secondary apnea, only stimulation and oxygen cannot return back the normal respiration. Only active form of resuscitation will be required to initiate the normal breathing of the newborn. And clinically, it is difficult to distinguish between primary and secondary apnea. So whenever stimulation and oxygenation within short period of time is not responding, then start active resuscitation. Preparation for resuscitation is delivery is an emergency. Every delivery room should have a radiant heat source, all the resuscitative equipments in working condition, and at least 110%. That's universal precaution and strict asepsis. There are so many equipments should be ready and functioning at the time of resuscitation. Most important is mucus extractor or suction apparatus, self-inflating bag with reservoir, that means ambu bag, or maybe a flow inflating bag, laryngoscope. This is the 2010 American Heart Association guideline for neonatal resuscitation. This guideline comes every 5 years interval, and this year, I think in 2014 November or December, the 2015 guidelines will come. Here the only we can predict the resuscitation by asking 3 questions: term decision, breathing or crying, good muscle tone. If all the if all the answers of these 3 questions is yes, then provide the initial routine care. Initial routine care is provide warm under a radiant heat source.
इतना सारा मटेरियल एक स्लाइड में रखना ठीक नहीं है, दिखाएंगे था ऑडियंस से।
गाइडलाइंस का कॉपी है, इमेज है सर ये।
Have to show to appreciate the flow chart.
Sir, I have mentioned later on the each step details. The equipment, sir.
जरूरत होने से अलग से टाइप करना है, कहीं यदि आपको प्रेजेंट करना है।
Each step details.
और यहाँ भी एक स्लाइड में इतना मटेरियल रखना नहीं है। It should not be more than 7 lines.
Sir, that's why I am highlighting the important ones. This is the important ones, which is in the bold letter. And this is the 2010 American Heart Association guidelines for neonatal resuscitation. This is the flowchart. By asking 3 questions: term decision, breathing or crying, good muscle tone. If all the 3 answers is yes, then provide the initial routine care, which is provide warm under radiant heat source. Air should be clear if it is actually necessary, drying of the newborn, and ongoing evaluation of the heart rate and respiration. If any one of this is no, then provide in rapidly providing the initial care, then assessment of the heart rate and respiration. If the heart rate below 100 or respiration is apnea or gasping, then start the positive pressure ventilation. The golden minute, the initial 60 seconds, it is very much important. It is for evaluation, providing initial state, and also starting of the ventilation, positive pressure ventilation if it is required. So the golden minutes is very much important. After positive pressure ventilation, then again assessment of the heart rate. If it is still below 100, then take ventilation corrective step. If then again the heart rate is below 60, then only consider intubation and chest compression and coordinate with positive pressure ventilation. 3:1 ratio, 3 chest compression, 1 ventilation. So in this guidelines, they have stressed upon the ventilation, not the chest compression, because the cause of neonatal asphyxia is mainly the failure to initiate the breathing, that means asphyxia, not the problem in the heart. And bradycardia is mainly due to the asphyxia and hypoxemia. Then if the heart rate again less than 60, then only.
यदि घर में डिलीवरी होगा क्या करना है? ये तो अस्पताल का बात बता रहे हो।
I did not take.
होम डिलीवरी में क्या करना है? वो भी बताना, वो भी बताना।
Completion of the presentation. And now the Apgar score, it is introduced in 1952 by Dr. Virginia Apgar. The total score is 10. It is based on the 5 important signs, and the score, each science consists of 0, 1, 2 score. Heart rate, absent, less than 100 per minute or more than 100 per minute. Respiration, absent, slow or irregular, good and crying, muscle tone, placid, some flexion, active movement, reflex irritability, no response, grimace, cough, sneezing, cry, and color blue or pale, pink body but extremity blue, and completely pink. And this is the Apgar score. Apgar score is important for assessment of the resuscitation. It is done at 1 minute and 5 minutes, but resuscitation should be started immediately. Should not wait for 1 minute. And after 1 minute, the Apgar score is assigned. So Apgar score assesses the effectiveness of the resuscitation, but not the need of resuscitation. The mnemonic, basic mnemonic of the resuscitation.
ये बढ़िया है, ये एकदम फाइन स्लाइड है।
Resuscitation is which already mentioned in the flowchart. That is the basic concept. That is TABC. In adult, that is ABC. Now it is changed to CAB. But in neonatal resuscitation, basic mnemonic is TABC. T means temperature control. A means clearing the airway. B means initiation of the breathing, and C is circulation control. Now the maintenance of the temperature. Radiant heat source should be provided for each and every delivery, and delivery room can be warm. All the wet towels should be removed. the newborn should be dried thoroughly, and whenever possible, when there is no problem, no complication, placing the baby skin to skin with the mother immediately after the birth. And establish of an open airway by positioning on his or her back or side with the neck slightly extended, and 1 inch soldier rod may be used. Suctioning mouth should be suctioned first, followed by the nose with a suction catheter 8 or 10 French. Suction pressure should not exceed 8 to 100 mm of mercury. And in case of meconium aspiration, the guidelines stresses upon that intrapartum suctioning, that means just after delivery of the head, they discourage this intrapartum suctioning because the several studies has found that intrapartum suctioning has no role, because the vigorous baby after amniotic fluid stain liquor, there is no role of this, there is no chance of meconium aspiration. But if the baby is non-vigorous, then there is chance of meconium aspiration. Then the depressed respiration in non-vigorous baby, meconium should be suctioned from the pharynx by direct infusion of laryngoscope, followed by brief incubation and suction of the trachea to endotracheal tube. And apply suction directly to the endotracheal tube when endotracheal tube is gradually withdrawn. And no suction by the catheter inserted within the endotracheal tube. Breathing should be initiated by tactile stimulation, that means flicking the sole or rubbing the back, but slapping the baby, it is highly discouraged. And breathing can be given by room air whenever there is paucity of the oxygen supply, but oxygen should be administered whenever it is required. That means there is no improvement within 90 seconds after birth, or in case of positive pressure ventilation are required, it is given by gas mask or oxygen tubing. And when there is newborn breathing but there has central cyanosis, then also free flow oxygen are required. Positive pressure ventilation, it is the main step of the newborn resuscitation. Indication of the newborn remain apneic or gasping, heart rate remain less than 100 beats per minute after 30 seconds after administering the initial step, and also persistent central cyanosis. Positive pressure ventilation should be initiated by bag and mask or by endotracheal tube intubation.